Hello, I'm Megan Schimpf. I'm one of the committee chairs for AUGS, and I work at the University of Michigan as a urogynecologist. We're here today to talk about the procedure called mid-urethral slings for stress urinary incontinence. The most important thing to realize up front is that stress urinary incontinence, which is leakage of urine when you do activities like coughing or sneezing, running, jogging, jumping, that condition is completely treatable. It's not normal. It's not something you have to live with. There are a lot of really good treatments for that problem, and you can always reach out to our website, voicesforpfd.org, to look for a urogynecologist who can help you get your life back. We're here today to talk specifically about one treatment, which is a surgical treatment. But in reality, there are many different treatments for this problem. Briefly, there are some things that you can do on your own. Losing weight will help your incontinence get better. Quitting smoking will help your incontinence get better. Working with maybe your regular gynecologist, you could ask for a referral to pelvic floor physical therapy to learn how to use your own muscles to help hold in the urine. There are also office procedures like using a pessary or having an injected agent around the urethra, kind of compress the urethra to help hold in the urine. All of those things are office procedures and are very good choices. If you've tried those, or if you're interested in having surgery right up front, that's what we're here to talk a little bit more about today. Surgery for stress incontinence has come a long way. It used to involve a big incision. It used to involve a lot of risk and maybe not necessarily a lot of success. But fortunately, for the last 20 years or so, we've been doing a very minimally invasive, simple procedure that has a very high success rate for stress incontinence. Mid-urethral slings are currently considered the gold standard or the best treatment option that we have for this problem, and they are about 93 or 94% successful if you ask patients after they have the surgery, and that's a pretty high rate. So we're pretty pleased with that. These are easily some of my most happy patients after their procedure. This procedure works and it has very low complications. It's an outpatient procedure, so it can be combined with other procedures if you need one of those. Maybe you need a hysterectomy, or maybe you've had a little bit of dropping of the bladder and you need to have some prolapse support procedures. That's a little bit of a different topic. So today we're just going to focus on only having a sling. So let's say you were going to come in and only have a mid-urethral sling surgery. That's an outpatient surgery. It takes less than an hour in the operating room, and then you'll be able to go home. Most of the time it's done under general anesthesia or an IV anesthesia where you're very sleepy and not really aware of what's going on. It's also an option to have it done with a spinal or epidural, where the anesthesia would be administered through a needle in your back. You should talk with your surgeon and maybe the anesthesiologist who's going to be doing your procedure to see which option is best for you. When you're positioned appropriately in the operating room, a small incision will be made in the vaginal wall, and a small thin piece of mesh material will be positioned underneath the urethra, which is the tube from the bladder to the outside. That little piece will be positioned using little needles that are passed through your tissues, either out into the groin or up behind your pubic bone, still within the hairline. Little stab incisions are often made at those sites, although some of these slings are shorter and don't require skin incisions. Talk with your surgeon about which option would be best for you, because the decision as to which sling is being done can be a very complicated one. Either way, you'll end up with no skin incisions outside the vagina or very, very little incisions that heal very, very easily. The incision in the vagina will be sutured closed with stitching, and that stitching dissolves, so you don't have to come back to have the stitches removed. The sling, the mesh sling that's put in, is going to be permanent though. It will be there forever, and there's a very small chance, roughly about 2% of the time, that sling can become exposed in the vagina later on. Sometimes that can be treated in the office, and sometimes that requires additional surgery. The surgery itself, like I said, is an outpatient surgery, so getting ready for surgery is usually very simple. You would come in on the morning of the surgery, and you'll need someone to drive you to the surgery as well as pick you up. The surgery is usually over and the whole process is over within a few hours, so you don't have to plan on the whole day. And most of my patients have very little pain afterward. So we do give patients a narcotic prescription, but most people take a few tablets, if at all, if any, of that medicine. Probably the biggest question that I get about this surgery is whether the patients need a catheter afterward. And the answer is sometimes. So I would say that up to about 30% of the time, patients have trouble urinating immediately after the surgery. And in that event, we usually teach them to catheterize themselves intermittently for a few days. Some patients have trouble doing that, so we put a catheter in and they go home wearing the catheter. But most of the time, people can learn to catheterize themselves on their own, and it's just a few days while we wait for your bladder to kind of wake up after the surgery. The whole process of having surgery can kind of stun the bladder. We just need to protect it while it recovers from the surgery and make sure that it empties okay in the meantime. The other question that I get a lot about this surgery is about the sling itself. So the sling is made out of mesh material, and mesh has gotten a lot of publicity lately. The thing to understand is that there's lots of different kinds of mesh surgery, and this surgery is very safe with a very low rate of complications. Possibly what you've heard on the news or in commercials is about mesh used to repair dropped bladders, which is called prolapse or a cystocele. That's a completely different surgery, and so the risks of that surgery are much different than a mesh sling for incontinence. Mesh slings for incontinence are supported by all of our national organizations as the best option for treating this problem. After surgery, we do usually recommend that people take it easy for a few days. Many surgeons recommend avoiding significant activity or very heavy lifting for about 6 weeks after surgery, but you should be able to be up and doing light activities and normal kinds of housework. Most people ask about when they can go back to work. That question is different for everyone. It depends on what kind of job you have and what kind of environment you work in. Some people are able to go back to work within a few days or a week. Other people need to take a little while longer off from work depending on how intense their job is with lifting and other activities like that. Other risks that we talk about with the surgery include bleeding. There's a very small chance that you could have to have a blood transfusion, but that's less than 1% with this surgery. Some people have trouble urinating and need a catheter or other treatments in a longer term, and both of those things are very uncommon. Talk to your surgeon for more questions about those. Overall, in summary, like I said, this surgery is a very popular surgery. It's really revolutionized how we can treat incontinence because it is an outpatient surgery and it's so minimally invasive with such a low complication rate, but yet such a high success rate. I have lots of patients who have been able to restore their activities after the surgery. They're running marathons, they're playing soccer, they're playing tennis, they're back at work, and they don't have to worry about incontinence when they laugh, cough, sneeze, lift, run, jump, or hit a great serve. Talk to your doctors about a referral to a urogynecologist to talk about this surgery and begin the process of getting your life back. Thank you.